What it do, guys? It's your boy D Neil back with another reaction video, guys. Here we are talking about Australian healthcare. Now I already know before I jump into it, I'm gonna be envious. I'm gonna be jealous. I'm gonna hate that we don't have the same type of healthcare, but I'm still gonna watch this. Before I do though, make sure you hit subscribe, ring notification bell, get a video a thumbs up so it gets suggested. Social media and Patreon, all up top. You know, subscribe to any of it. Put all the links in the description. All you gotta do is hit the link, follow me, talk to me. Sure, man. I talk back. If you got a favorite video suggestion, you can subscribe to Patreon or in the description section there's a Google form link. What we got?
It's been a while since we've done an international healthcare system episode. We thought you might need a break. That break ends now. Australia has the only continental universal healthcare system, and it's the topic of this week's Healthcare Triage. Like pretty much every other country we've covered, save the United States, Australia has a universal healthcare system. It's called Medicare. What is the deal with that? Seriously, do none of these countries have a thesaurus or something? Medicare, Medicare, Medicare. Anyway.
I swear to Medicare everywhere. That's what it should be called, Medicare everywhere. You feel me?
With that. Seriously, do none of these countries have a thesaurus or something? Medicare, Medicare, Medicare. Anyway, Australia's national public system provides coverage for citizens, permanent residents, and even many people with temporary visas. There's a program for visiting students, and even people seeking asylum get coverage while their cases are under review. Australia also has a voluntary private health insurance system, which complements and supplements the public one. It can give citizens access to private hospitals and some services not covered by the public system. The tax system incentivizes the purchase of private insurance for many individuals and families. Medicare also allows people to get free inpatient care in public hospitals, free access to most medical services, and prescription drugs. The federal government also works with more local governments to provide population health, mental health, some dental care, some physical therapy, and services for veterans. Medicare
all right. I'm just, I gotta go get my bags packed, y'all. I don't know if I have time to finish this video. I just need to get packed because I'm moving to Australia, man. Australia, I'll see you guys in a little bit, man, because I'm out of here. That's absolutely incredible, bro. Australia doing it up right like I thought they would be. Keep it rolling.
Mental health, some dental care, some physical therapy, and services for veterans. Medicare pays for somewhere between 85% and 100% of outpatient services. It also pays for 75% of the medical fee schedule for private patients who use public hospitals. Whatever isn't covered must be paid for by patients. Doctors can charge whatever they want, although incentives are in place to make bulk billing more likely for the elderly, poor people, children, and people who live in rural areas. Members of those groups also get a discount on drugs. Their co-pays on prescriptions are around $5.90 Australian versus $36.10 for everyone else. There are out-of-pocket maximums. When an Australian is paid out $421.70, then Medicare covers 100% of the fee scheduled for doctors for the rest of the year. When they reach $1,221.90, then 80% of all out-of-pocket costs are covered for the rest of the year.
Bro, shout out Australia taking care of the people. And if the people are less fortunate, they have less, then they're going to give you discounts. You feel me? They're going to make it easier for you because they prioritize people. Shout out Australia. You guys are doing an incredible job. This sounds like an incredible healthcare system. Just saying, if I were to spend $1,221, all 80% of all out-of-pocket costs are covered. Boy, y'all something else.
Then 80% of all out-of-pocket costs are covered for the rest of the year. For people in the special groups I mentioned before, the threshold is lowered to $610.70. Yes, that's complicated. Thanks, Australia. There are also ways for families to pool such spending and to hit the limits faster. There are pharmaceutical subsidies for those who reach a threshold of $1,391 in a calendar year too for drugs. The threshold is also lower for those in the special groups at $354. Australia is one of the cheaper healthcare systems. At 8.9% of GDP, Medicare is paid for mostly from general taxes, patient fees, and a 1.5% levy on taxable income. In 2010 to 11, the government funded about 69% of spending, 43% at the federal level, and 26% from states and territories. The rest, or about 31% of healthcare spending, comes from non-government sources. About 18% is out-of-pocket spending, in co-pays or services not covered by insurance. Private health insurance accounted for about 8% of spending, About half of people have private insurance, which allows them more options in practitioners, hospitals, and care that they receive. Those who opt for private insurance before their 31st birthday get a reduction in premiums for the rest of their lives. Each year, an Australian waits to start buying private insurance after they're 30 sees their rates go up 2% from a base rate, again, for as long as they live. Subsidies have been available to many Australians based on income since 1999. Most primary care doctors...
All I'm saying is, it just sounds, the more he talks, the more attractive Australia sounds. They just care about their people, man. They're not going to kill you. You're not going into crazy debt paying medical bills. You're not going into debt paying medical bills. They got you. They got you over there.
Been available to many Australians based on income since 1999. Most primary care doctors are self-employed and work in groups. About 8% of them are under contract with private agencies. Most work in a fee-for-service system. Most also get incentive payments for meeting standards set by the Royal Australian College of General Practitioners. In other words, they have a pay-for-performance system to try to improve quality. I know you watched that video, right? Patients can see any general practitioner they like. GPs do, however, need to refer them to specialists. Specialists also work on a fee-for-service basis, and many of them work in both the public and private parts of the system. After-hours care is available either from primary care docs themselves or from private companies set up among various practices. Grants are available from the government to run after-hours care. Hospitals come in all flavors. In 2011, about 55% were public, 23% were private day hospitals, and 21% were other types of private hospitals. Private hospitals come both in non-profit and for-profit types. Docs that work in public hospitals are usually salaried, although they can work in other reimbursement settings when seeing private patients. Long-term care is mostly provided by families, with some people getting subsidies to help with the expenses. Some homes or care centers are available for those who are very dependent on assistance. Support is...
I love it. You know what I really love is the pay by performance. I love that. No, no sense. So how good you do at your job. You know, how much you get paid, or if you're at a public hospital, you're on salary. But it just sounds it sounds like an amazing system. It sounds like we as the U.S. need to pull out a pen, pull out a paper, take notes, but then we would have to prioritize the citizens, the people, over the profit in order to create a system like this.
Some homes or care centers are available for those who are very dependent on assistance. Support is both means-tested and dependence-tested. The majority of long-term care facilities are non-profit. About a third are private, for-profit, and about 10% are run by the government. Quality is generally measured and reported on by the Australian Commission on Safety and Quality in Healthcare. About 85% of general practices are accredited against standards. And, as I mentioned before, pay-for-performance systems are in place to encourage better care. Some healthcare organizations and professional boards also have quality improvement programs. All citizens and permanent residents can get a personally controlled electronic health record if they want it. A fairly large amount of infrastructure exists to make such records interoperable at many facilities across the continent. Costs are controlled in a number of ways. The market uses generic drugs to keep pharmaceutical spending down. Almost all brand name drugs are bulk purchased by the government, which can also control pricing. New drugs have to prove their cost effectiveness before they're bought. Public spending is under global budgets, but as with some other countries, this can lead to increased wait times for elective things. There are also broadly negotiated fees for many services. The knocks against the system will be familiar to those of you who are familiar with the series. Australia is worried about a shortage of professionals, but who isn't? In terms of quality, Australia sometimes comes behind some other countries we've discussed, but certainly beats others, like the US. The private overlay makes some people there concerned about a two-tiered system of care. It's interesting, though, that only about half of people opt for private insurance. Australia also has a disparities problem, with many Indigenous populations having lower quality outcomes and poorer health than other citizens. But life expectancy is high, infant mortality is low, obesity is extremely low, and preventable deaths are rarer than a lot of other countries. And Australia does it for a reasonably small amount of money. In summary, Australia has a pretty robust public healthcare system with a private overlay that half of people use for better access and services. If that sounds familiar, it's because it's much like other systems we've talked about, including France.
Now, Australia, y'all just doing it right. Y'all just doing it. I knew I was going to be jealous. I knew I was gonna be envious. I knew I was gonna be upset. I knew that I was gonna want to pack my bags, pack up all the possessions that I own, and head straight for Australia. I knew that. But that was a dope video. That's all we got for this one. If you guys got a favorite video you want to see or hear me react to, you can subscribe to Patreon. Also, in the description section, there's a Google form link. Hit the link, fill out your suggestions, send it to me. Want me to get to yours faster than others, fill out premium. Make sure you hit subscribe to the channel, ring notification bell, get a video a thumbs up so it gets suggested. Social media and Patreon, all up top. You want to subscribe to any of it? Put all the links in the description. All you got to do is hit the link, follow me, talk to me. Love talking to you guys. You guys are the most incredible team on YouTube. It's your boy D Neil, out.